So thank you, everybody, for joining us this afternoon for The Doctor is In. Our topic this month is heart health. And we are fortunate to be joined today by Dr. Greta Byers, who is a sports medicine fellow at Jefferson. For those who are new to The Doctor is In, I think I recognize all the names of folks here, and you've been with us before, but Doctor is In is a partnership between Jefferson Health, the Department of Family and Community Medicine, and us at the Elder Initiative at the William Way LGBT Community Center. And so we do these monthly programs as an opportunity to explore different health topics relevant to us in the LGBTQ community, with Jefferson doctors graciously coming in to share their expertise, take questions, and really be a resource to help folks better care for their health. Before I turn it over to Dr. Byers, just a couple of logistics. At any point during the program, you can ask your questions either using the chat or the Q&A. You can access both of these in the toolbar at the bottom of your Zoom screen. Do note when you are using the chat that your name does show up when you are using the chat, and that is publicly viewed by others in this webinar. If you are asking anything that might be more personal or that you would like to ask anonymously, you should use the Q&A feature where there is an option to ask your question anonymously. I will be reading off all of the questions to Dr. Byers, who will stop periodically for questions. So whether you're asking your questions in the chat or through the Q&A or on Facebook, I'll be reviewing those and relaying those to the presenter. I think that's it for what I wanted to cover. Thank you again for being with us. And I turn it over to Dr. Greta Byers.
Hi, everyone. Thank you for joining today. Like you said, like was said before, my name is Dr. Byers, or Greta Byers. You can call me Greta. I'm going to present today on heart health. This is a modified presentation from Dr. Alanoff, who did this presentation a little while ago and was generous enough to collaborate with me on it. So February is American Heart Month, so this is appropriately timed. So appropriately awareness of this talk, and just encouraging everyone to be able to be in control of their health and pay attention to their blood pressure and everything that comes in when they come to the office for regular visits. So my objectives today is to identify the most common types of heart disease, look at how heart disease affects the general population, and also learn the symptoms of heart disease. What should you look out for? What symptoms are kind of worrisome, and things that you should see a doctor sooner rather than later. But also see how we can prevent heart disease. Like maybe you're not affected by it now, but let's see what you can do now to prevent it in the future. And then think about how we can be healthier if we already have heart disease or if we're trying to prevent it, just being healthier individuals overall to optimize our heart. And then I was going to test some knowledge of heart disease with a fun little group quiz, but I know the webinar presentation isn't always lend well to that. So please put questions in the chat. I'm happy to answer whatever questions you have. So I say heart disease, but what is it? Heart disease generally refers to a wide group of illnesses that affect the heart. The most common type of heart disease is that coronary artery disease. So what people think of is as like having a heart attack. Other common heart disease includes heart attacks, heart failure, and arrhythmias. Coronary artery disease, you don't have to have a heart attack, but it could be that you just have a little bit of buildup as well. But all of those fall under the general categorization of heart disease. So we're talking about heart disease, but why are we talking about heart disease? How many people are affected by this? So it's actually the leading cause of death for both men and women in the United States. 1 in every 5 females it affects, and then 1 in every 4 males deaths it's affecting. So you can see the general population that there's a high prevalence in this lower southeast region. But even us up in the Northeast, we have some dark spots. We have some high prevalence as well. And so you can see heart disease does affect many people, often over the age of 35. Coronary artery disease. So what are the coronary arteries? So your blood is a muscle, just like your muscles in your legs and your arms. And to be able to be function and use, they need blood, and they need, because blood carries oxygen and blood carries energy. And so for your muscle, your heart muscle, to get that energy, it needs blood. And how it gets it is through your coronary arteries. So a normal artery is nice, open wide, so that blood can come through it, go to the muscle, and the muscle can work hard and well, and be able to pump that blood out to the rest of your body. Coronary artery disease is when that blood vessel gets narrowed. So the blood isn't able to travel through it as well, isn't able to supply that heart muscle. So that heart muscle doesn't have as much energy as it could, because the blood is not getting as much energy and blood supply through those coronary arteries. How does it get narrowed? It often gets narrowed through these plaques, which is often from like cholesterol or different types of plaques that can build up in those arteries that can narrow and narrow and narrow that pathway. So that blood has a harder and harder time getting to the muscle to provide that energy that it needs. What causes coronary artery disease? So the fancy term is atherosclerosis. So it's a buildup of plaque along these arteries, and it's often, and you can see this image here on the left. You can see how the buildup over time really narrows that artery, and those plaques build up from like the cholesterol in your bloodstream and damage to the lining of the arteries as well. And you can see how that passageway gets narrowed. So these blood cells, not all these blood cells can get through. It's a lower percentage of blood cells, and you have less blood supply to that area. So coronary artery disease affects so many people. So what are the symptoms that everyone should look out for? So the thing about coronary artery disease is, until it causes a problem, you might have no symptoms at all. So if it's just like a little bit of a plaque, or if it's just a little bit of narrowing, your heart might get enough blood supply that it's not feeling the effects, and you don't feel the effects yourself. But then as that artery gets narrower and narrower, you might start getting symptoms to pop up. They can be subtle little symptoms like some chest pain, often because your heart's not getting enough blood supply. And so that the heart is like basically like a sore muscle, like it's tired. The heart is showing that it's tired. It's not getting enough energy that it needs. So the plaque is narrowing it too much, narrowing the blood supply too much, and causing that chest pain. And then the heart attacks that could be your first symptom though. So all of a sudden you could have a blockage, and all of a sudden you're in a heart attack, where you're not getting that blood supply at all. And your heart muscle is, in that sense, dying a little bit, in the sense that it's not getting enough blood supply. And so the muscle kind of is dying in that aspect of things, and it needs to get that blood supply returned. What health conditions can increase your risk of coronary artery disease? So things that increase your risk: high blood pressure. It can damage those arteries. It can make it harder to get that blood out to your heart. And so that is often a risk factor for coronary artery disease. Also, high cholesterol levels. Cholesterol is often in that buildup of plaque. And so the high cholesterol levels will affect the rates at which you can form those plaques. Diabetes, that's extra stuff in your blood. So you have extra amount of sugar in your blood. So it makes the blood thicker, makes it harder to travel different places. And so it also increases your risk factor of having other diseases. And so diabetes is a risk factor in and of itself. And then obesity as well. You have a general higher level of fat, not exercising as much. And so you can also get increased risk of coronary artery disease.
Could I jump in with a question?
Yeah, I was actually going to stop right there for any questions. So perfect.
Because there is one that came in related to what you were just talking about. Yep. Is calcium buildup, is that a form of plaque, or is that something different?
Calcium buildup is slightly different. So calcium buildup is often like a effect of the bones, or effect of like the parathyroid, which is a different gland in your body. So you can have calcium buildup, but cholesterol and the plaques are often made up of like cholesterol instead of that calcium. Calcium is a different type of, a different type of material that isn't as involved in plaques.
So plaque is coming mostly from cholesterol?
cholesterol, different types of fat and fatty tissues within your blood. Yeah.
Great. Thanks. That's all that's coming so far. But
Right.
again, folks can ask their questions at any time, and we'll pause periodically.
Absolutely. So what behaviors increase your risk of heart disease? So on the diagram on the right, 10 key risk factors for heart disease. So obesity and overweight, we talked about that, like increasing the amount of fat that you have as part of your system. High cholesterol, your diet greatly impacts your body in so many different ways, but one of them, of course, is going to be your heart and your heart health. Lack of exercise. How much are you getting that heart rate up, blood flowing? The heart's a muscle and it needs to be used, and it needs to be used to kind of be strengthened and continue. And so how much you get that heart rate up with exercise really affects heart health as well. Diabetes, the extra sugar in your blood can impact your heart health as well. And then high blood pressure, how much blood is getting to your heart? How hard does your, excuse me, how hard does your heart have to pump against so if you're thinking your heart is pushing the blood out to your body, but how much force does it have to use to get that blood out? Smoking will also affect your arteries and will make them constrict a little bit more, so it's harder to get that blood through them as well. Just with age, you just get general constriction of your arteries, so it's not as something that you can affect as much. So it's not something that you can obviously change. Gotta love aging, but there's so many modifiable risk factors. The genetics and preeclampsia is also not something that you can always change, but there are lots of things on this list that you have control over and you can do something about so that you can help protect yourself against heart disease in the future. So even if you have coronary artery disease, that's not like, oh, that's not an end all be all. You can do stuff to change your health and to improve your risk of getting things like a heart attack or stroke or whatnot. So lifestyle changes. So quitting smoking. If you quit smoking, you can drastically improve your health in many different ways, but one of them is your heart health. So if you 15 years without smoking, you equivalent your risk down to that of a non-smoker, that we don't worry as much about the effects of smoking on your health. And you also really take away that impact on the arteries from the continuation of smoking. Eating healthier, less salt, less fat. The salt can raise your blood pressure. The fat can raise your plaque content. And so just more whole grains and vegetables to decrease that thickness in your blood. And then increasing physical activity. You need to exercise that heart. You need to exercise that muscle. To use that muscle makes it stronger, makes it better. And so increasing that physical activity. Medications also do play an important role. So unfortunately, there were some non-modifiable risk factors in those risk factors I just talked about. So there are things like genetics that you can't really change. And sometimes you just need a little added help. And that might be that you're doing everything in the lifestyle changes, but hey, your blood pressure just is a little higher. Just because you have those genetics that predispose you to a high blood pressure. And so medication might be needed in that sense to make sure that you get that blood pressure down, better your heart health, better your chances against coronary artery disease. There is also genetic predisposition to high cholesterol. So you might be eating the best diet out there, but you have a genetic predisposition to high cholesterol. You could even have familial trait that gives you a higher cholesterol levels, and you might need a medication to help lower that level to help decrease your buildup of plaques in your arteries. Any questions so far in that sense?
Doesn't look like it right now, but
I'll keep rolling then. Please
awesome.
feel free to continue with any questions and whatnot. So every 40 seconds, someone in the United States has a heart attack. So when I say these risk factors and whatnot, it's not that there's that these happen every year, or every 50 years, or every 100 years. Like, they're happening quite frequently, and you probably can think of somebody that you know that had one. And so trying to lower your risk, and also how you can help friends. Like you can, if so, you can be the educator of your friends. You can take this information and help motivate somebody else to get a healthier lifestyle as well. So what is a heart attack? So that is when that artery is completely blocked off. And so then that muscle has no supply to it of that blood. And so you start getting muscle damage, muscle death. And so you need a good functioning muscle to get that blood out to your body. And when you get that damage and death, it's not going to work as well. Your blood's not going to get out to your body as well. And then you have a problem. So in heart attacks, the best thing is to get to emergency room soon so that they can have the best chance at trying to reestablish that blood supply to limit the amount of muscle damage, limit the amount of death to that heart, to make sure that you can get as much muscle function back to get as healthy a heart as possible if that was to happen. So everyone, most people come in and they're scared. They're like, oh, am I having a heart attack? What's a heart attack like? I'm so scared of this thing that could happen. So things that can decrease fear, but also make you feel a little bit more in control is knowing the symptoms so that you know what to look out for and then you know when you should go get emergency care. So chest pain or discomfort, that can be a lot of people describe it as a pressure in their chest. It just feels like chest heaviness that's not going away. Chest pain, it can be sharp pain as well. It can be left-sided, but I'm not discounting right-sided pain at all. Sometimes worse with exertion, worse with exercise because you're trying to use your heart more. And so your heart just can't do it. It's often accompanied with shortness of breath. So you feel like you just can't get that deep breath in, or you just have to take quick breaths. You can have pain that travels. So it could go down your arm. It can go to your back. It can go up your neck or into your jaw. So it's traveling either down that arm to the back or upwards towards your jaw and your shoulder. Often because you're in that state and your heart's not pumping as well as you can feel a little nauseous, a little lightheaded, and usually tired because your body's not getting as much of that blood supply out to it, and because your heart's having a little bit of trouble. So getting any of those combinations of symptoms together, it's always, especially symptoms that aren't going away, that are being persistent for minutes to like an hour, you should definitely seek care. No one's going to fault you for having chest pain and going to seek care, because being cautious is always better than waiting and seeing and God forbid something happening to your heart. So risk factors for heart attack are very similar to those for coronary artery disease. So again, coronary artery disease can lead to a heart attack. So a lot of those risk factors will be the same. So you can see they're all the same risk factors. So it's diabetes, high cholesterol, high blood pressure, smoking, family history. There are modifiable ones, so ones that you can control, that you can have an impact on, that can lower your risk of a heart attack, just like they lower your risk of coronary artery disease. They're very interrelated, very tied together. Again, there are some that you can't control, and I think the ones where you can't control them, that's where medication can help, in the sense that we can help you lower your risk with medication, because you might have that genetic predisposition to it. So heart attacks are always scary, always bring up a lot of topics. So any questions or anything right now on that?
There was one question that came in going back a couple slides when you were talking, I think, with the diagram of risk factors, but just what is, and forgive my pronunciation, preeclampsia?
Oh, yeah, I'm sorry. So preeclampsia is actually affects pregnant women. So that's high blood pressure in pregnancy. So there's a lot of complications that can come with that. And it can affect your body in different ways. So with pregnancy, if you have high blood pressure in pregnancy, it comes with a lot of different complications because you have the fetus as well, and it can lead to seizures as well in the end. So there's a lot of different complications that come with that, and it's an independent risk factor for heart disease even after having the child. So that is a separate risk factor. I hope that describes it well. It's high blood pressure, in simplest terms, high blood pressure in pregnancy.
But that can then have effects later in life. So if someone gave birth 50, 60, 70 years ago, it could still be
It can, just because you had that higher blood pressure that your heart had to work a little harder on it. It can have some long-term effects.
Great, thanks.
Yeah. Okay, so these are risk factors for a heart attack, but say you do have a heart attack, but and so I wouldn't say, okay, you had a heart attack, let's give up there. You already had a heart attack. Why would I care about anything further? So you can have multiple heart attacks. You can still lower your risk of having another heart attack in the future. So you still want to work on those modifiable risk factors. Quitting smoking, huge risk factor for a heart attack. Getting more exercise and eating that healthy diet. Those are the 3 key things that I would put at the top of your list for helping prevent a future heart attack from happening, even if you've already had one. And it'll help in your recovery from a heart attack, just because it'll help utilize your heart a little bit more, make the load a little easier on your heart to get it back pumping and trying to use that muscle. So blood pressure. Blood pressure is a hard concept to kind of wrap your mind around a little bit, because blood pressure, a lot of people, it's something that us as doctors worry a lot about, but patients can't really see the effects of blood pressure, just because it's often you don't really feel high blood pressure. It's not like you can feel something and all of a sudden your blood pressure is a little higher. Often when you're feeling those symptoms and your blood pressure is insanely high, and that elevated blood pressure that your doctor's like, oh, I kind of want it down a little bit, you're often not even feeling the symptoms of, and so it's kind of hard to wrap your mind around. But imagine like you have pipes and you're trying to get something through the pipe, and so blood pressure is when you're trying to the pressure through that pipe is very high. So they often give you 2 numbers. There's a top one, which is called your systolic blood pressure, and a bottom one that's called your diastolic blood pressure. So the systolic blood pressure is the pressure in your arteries when your heart beats. So when your heart is beating, it's contracting. So it's squeezing the blood out to your body. And that's the high one. That's the highest pressure that your arteries are feeling. And then the bottom one is when your heart's relaxing. So that's when your heart's not pumping that blood out. And so what's the other pressure? When your heart's just at rest. And so it's relaxing. And so the pressure, the blood pressure is the pressure that your arteries are putting on the walls of, your blood is putting on the walls of the artery. So it's how much pressure that your arteries are having to sustain. And higher blood pressure can damage those walls and easily cause higher buildup of plaques. Some complications from high blood pressure. So we're talking heart health. So heart attacks are complications. It can also cause strokes. It can also cause kidney damage. You can just it causes that blood vessel damaging. That high pressure just damages that blood vessel, can cause it to constrict and be stiff. So I equivalent it to think like, if your pressure is high, it's going to be harder to get to all of your organs, and your organs needs that blood for energy and oxygen and to function well. So it affects your organs, it affects your kidneys, your heart, and your brain. So lowering that pressure makes it easier for those organs to use it. And so it is important to try and get that lower to protect your risk of damaging any of those organs. So we're talking about blood pressure. What should it be? So there's general disagreement in the medicine world about where it should be. Different organizations will say different things. So some will say less than 130, some will see less than 140, some will say less than 150. Generally 140 over 90 has been a long-standing thing of where it should be around. But as you age, that gets a little bit more lenient. Some doctors say less than 150 over 90, because the opposite could affect you. You could have too low of blood pressure, and then that's also a problem too. So the biggest thing is to talk to your doctor. So just be aware when you go in, those numbers do matter. And so when they tell you your blood pressure, just be aware of what your blood pressure is around, and talk to your doctor and say, is this the right range for me, or should I be lower or higher? where should I be? And just have that goal in mind so that you can be aware and in control of your health and in control of your risk factors for different diseases. If you are nervous that you're going to have high blood pressure, or you have high blood pressure, there are modifiable things that you can do and be in control of. So keeping a healthy weight, cutting back on smoking, and getting exercise. Those are always the big three things. Other things though do affect it, like managing your stress levels. Higher stress, that blood pressure is going to go up. Getting enough sleep. Sleep affects the cortisol levels, which is your stress hormone. So it can also affect your blood pressure. And getting that sleep to decrease those cortisol levels and make you a little bit more relaxed and helping that blood pressure will also help. In some medications though, just like I said, for heart attacks and coronary artery disease, you do have genetic risk factors that you just can't change. And so that blood pressure may be higher, but you need to lower it so that your organs are protected. And that's where you might have to take one or more medications to keep your blood pressure at a safe number. And I know medications aren't always something that someone wants to be on, but sometimes just to protect your organs. And if you have a genetic predisposition, or you just need a little time to be able to cut back on your weight or smoking, that's where those are super useful and can help protect your health and decrease your risk. Also, where can you check your blood pressure? So you can check it at the doctor's office. That's why I would be aware of your blood pressure whenever you go in the room, but also a lot of local pharmacies will have cuffs that you can check your blood pressure. And some people will even get home cuffs where you can check your blood pressure. Some people are nervous when they go to the doctors, and that automatically elevates your blood pressure. So having a home cuff can kind of check it when you're not as nervous, not as anxious, and see what your blood pressure is probably on a regular day compared to when you're at the doctor's office and a little stressed, a little nervous. So sometimes home monitoring is actually the best monitoring. And I wouldn't do it every day. I wouldn't do it every day or focus on it too much, because then you can get stressed about it. Then you can do it like once a week or once a month, or depending how well controlled your blood pressure is, once every few months. But just kind of being aware of those numbers and in control of your health. So before I move on to cholesterol, any questions on blood pressure?
There was one question that came in specifically asking about coffee, and I would maybe expand it to caffeine in general, of both, and then I guess their effect on blood pressure and more broadly heart health.
Yeah, absolutely. So caffeine can increase your blood pressure. What also people don't know is alcohol can also increase your blood pressure. So both of them can increase your blood pressure, which of course is a higher blood pressure is a risk factor for heart disease, as well as for heart attacks. I will say for everything there's moderation. So for caffeine, I think a healthy cup of coffee or two is totally completely fine. Same with alcohol, like a glass every couple of days is fine. But you'll just know that those things can raise it a little bit. So if you have high blood pressure and you want to try and lower it down, maybe lowering your intake of that could be helpful. But I wouldn't say like absolutely no to all of the above. I think a little bit in moderation would be appropriate.
Great, thank you. And we did talk in one of our other doctors' ins last year, I think, talking about blood pressure. Maybe it came up as a risk for other health issues, but we did talk. It's the white coat. Is that what they call it?
Syndrome? Yeah, white coat syndrome
yeah.
is when you come to the doctor and you have high blood pressure just because you're so nervous about being at the doctor. Yeah, the true thing. It's very true. It happens all the time. All right. So
those are the questions for now. So yeah, let's get to cholesterol.
Yeah, so cholesterol is this waxy fat-like substance. It's made by the liver. It makes hormones and it digests fatty foods, and our bodies make all the cholesterol that we need, but we get more cholesterol from the foods that we eat. So we make the cholesterol that we actually need for daily living, because it is important to digest some foods and make hormones, but we also get extra, and that extra can, if it's too much, can become a problem. So you hear bad and good cholesterol. So what does that mean? So we typically say the LDL is the bad cholesterol. And then the HDL is the is called high density lipoproteins, and it's the good cholesterol. How I remember it is L is lower on the list, H is higher on the list. So higher is better in my mind, but other people can make their own mnemonics and whatnot over it, or can just memorize and remember it, but just LDL is bad. So LDL is most of your cholesterol, and really high levels can increase your risk of heart disease and stroke. And you make, so to lower, if you have high levels of your LDL cholesterol, you can modify it by diet, exercise that can impact your LDL cholesterol. But if it's too persistently high, you might need a cholesterol lowering medication. And the main one that we use for that is a statin, which is, if anyone's on cholesterol medication, the most common ones are like atorvastatin, which is generally called Lipitor. And that's a very commonly used cholesterol lowering medication. HDL is your good cholesterol. It helps the cholesterol get back to your liver, and then your liver flushes the cholesterol back from your body. So high levels of that actually are good. So you want high levels of your HDL and low levels of your LDL. So the L and the L and the H and the H. And the high levels can lower your risk of heart disease and stroke because it helps get rid of that cholesterol. So you may need to eat foods that have good fats in them. So not all fats are bad. And you want the more of the good and less of the bad, in general. So high cholesterol foods, high of the stuff that we don't want, but everybody wants to eat because it always tastes the best. Those lovely burgers and fries and wings and bacon and pizza, those are all high cholesterol foods. Your chips, your cheese, all of that stuff is going to increase that LDL cholesterol, which is not going to be as ideal for heart health. Foods that help lower your cholesterol, which are also pretty good, are sweet potatoes are my favorite. Same with avocados and some eggs. And then you have nuts, legumes, like that kind of stuff, as well as broccoli. All those are filled with that good cholesterol that helps rid the cholesterol from your body. More example of foods that help lower your cholesterol. You can see those bright, nice colors. Always like bright, nice colors on your plate. I think you run into trouble if your whole plate is like brown or yellow most of the time. So getting that diversity in colors. You can still have chocolate. That's also on the list. Some nice dark chocolate, some berries. Get that sweet if you have that sweet tooth in you. But also those nuts. And I wouldn't say, of course, like I talked about before, everything in moderation. So you don't want to get like 2 gallons of nuts and eat them by the handfuls. Like a small portion of nuts is appropriate in that sense. Fish is always great. Wild salmon is lovely for cholesterol, really helps with your heart health. Managing high cholesterol. So, okay, you went to the doctors. They were like, oh, shoot, you do have some high cholesterol. What can you do to do it? I feel like I sound like a broken record, but healthy diet and exercise regularly. And you can make some other simple lifestyle changes with what you're eating, smoking, and whatnot. All will impact it. But again, if it stays high, some people just need a little extra help. And you might need a medication. And generally, the cholesterol medications are highly safe for daily use with very minor set of risk factors. Genetic and family history play a role, so don't be as hard on yourself. There are some things that can impact your cholesterol that you have no control over, and we can help you with as well. We can also help with diet and exercise. Like there are different resources that we can help with coming up with good exercise recommendations or diet or nutrition and getting you plugged in there to try and help. So don't try and do it all on your own in that aspect of things, and reach out for help when you need it. So statins, I talked about statins. So that's the class of medications we use to lower the cholesterol in your blood. How they do is they help clear out that cholesterol in your blood and help your liver process it through so that you can excrete that cholesterol. When should you take your statin? Every day. It's a daily medication. What are the side effects? The side effects are there's a very, very, very small percentage of people that get some muscle side effects from it. And If you do have those, you should, you will feel those muscle aches and cramps, and you should let your doctor know. Always when starting a new medication, you should have some regular follow-up just to monitor you for some side effects and see how you're doing well if you're doing well on that medication. Grapefruit juice, there are some people that say you shouldn't do a lot of grapefruit juice in anything because it can affect how your liver metabolizes certain medications and they won't work as well. You have to drink a lot of grapefruit juice for it to make that effect. So I wouldn't say take it always at the same time as your medication. I say you can always do a little bit, but if you drink a lot of it, I would definitely mention that to your doctor to make sure it's not affecting your medication. And now I'm at the test your knowledge, so I'm gonna kind of go by that. But I'm open to any questions. In general, I will say, I feel like I repeated it time and time again. Like diet and exercise is always great, but it's always super hard to do. So I think doing whatever you can, even if it's something small, even if it's once a week, just starting small. And then if you don't get to it that week, don't feel like, okay, I'm done forever. Like try it again the next week and follow through from there, because it can really impact your heart health and can affect your health in many different areas. If you need resources or just need a different way to go, you can always reach out to your primary care doctor, to sports medicine physicians. We can always help guide you on different places to go if you don't even know how to get started. But thanks for having me, and hope this helped a little bit, and happy to answer any questions.
Absolutely. Well, thank you very much, Dr. Byers. I had two questions that came in specifically about cholesterol, and then I'll give some time for folks to get their questions in about anything else that we covered today. First, how often should someone be getting their cholesterol checked?
So cholesterol checks, different providers will do it differently. And it depends on your risk factors for how often you should get it checked. In general, for a very healthy person, it's like once every 5 years. But often a lot of different risk factors are at play. And so people get it checked more frequently. If you have high cholesterol, I do at least yearly, just to monitor it. And then if I have someone that's going to do that's working on trying to lower it, I might check it like a little bit more frequently to see if those actions like diet and exercise are helping with their cholesterol, or if they need more intervention sooner. So I'll typically let my patients like try some diet and exercise and see if that helps, or diet changes, and then recheck it in a few months to see if it's lowered or stayed about the same.
Awesome. There was a question specifically about brown rice, since that was on the list of foods that can lower cholesterol. The question being, does that raise blood glucose?
So brown rice, it's more whole grains instead of white rice, which is a little bit more simple carbs. So brown rice has a little complex carbs. I'm not the most well-versed in nutrition. That's why we have lovely nutritionists. But brown rice, it doesn't have as much of those simple carbs that will go into sugar. I will say any type of rice does have that sugar component to it. So I would say in moderation, but in general, if you're going to pick any rice, I think brown rice has the best effects overall, just because it has that whole grains complex carbohydrates, which are a little bit different than that simple sugar that you get from the white rice. If that makes sense.
Yeah. Another question. When should someone take their statin? Is it important for it to be at the same time of day consistently? This person said that they were told to take it at night.
So some people, I generally say my rule of thumb for medication is take it when you can remember to take it. So if it's every night, take it every night. If it's every morning, take it every morning. If it's every day at lunch, go ahead, take it every day at lunch. There are some specific medications that you want to take in the morning or at night if you're directed by your doctor in a specific way. For statins, somebody may know something that I don't know, but I typically just say take it once a day whenever you can remember it. That one's not one that I'm aware of that you should take at a specific time of the day. And if you miss it by an hour, or if you miss it by a few hours, it doesn't, it's okay. Just take it when you remember it. Again, if it's the next day and you're about to take your next pill and you realize you didn't take it yesterday, you don't need to take two, just take one. But you can miss it. It can change by a few hours. Something like birth control, that's more like you have to take it at the same time every day. but a statin is not as specific to the time.
Mm-hmm. Great. So we talked a bit about screening for blood pressure and also for cholesterol. Are there other, thinking of all these risk factors, are there other like screenings that you in a healthcare setting are typically doing that's really getting at checking someone's heart health?
For me,
or are those the two big ones?
You do some screenings that you like don't really acknowledge every time at a visit. So you're doing like height and weight. So BMI is a big one, and obesity is also a big one that contributes to heart health. And so you're screening people's height and weight and kind of providing counseling off of that. And that's a risk factor as well. I generally ask like socially any risk factors like alcohol use and smoking and screening for that, because those can both impact your heart health too. So those are the general screenings that I'm doing. I'm not doing any more blood work besides maybe a cholesterol level as to look at heart health on a more regular basis, or doing any formal things like a questionnaire or anything more to look at heart health. In people that have diabetes, there are different impacts that you can have on your specific risk for heart disease. And so there is a risk calculator that we typically run on everyone that has diabetes, and most people, and if you do have diabetes, we do typically recommend that statin medication, because you are at increased risk automatically for heart disease in general.
Okay, with diabetes.
Yes. Mm-hmm.
For heart attacks, what's the sort of rehabilitation, I guess, after a heart attack? What does that typically look like? Or what's the prognosis?
Yeah, so it really depends. So there's a lot of different arteries that can supply your heart. And it depends like which artery was affected, how many arteries were affected, how long it took for people to regain blood supply back to their heart. Some people need an intervention where they need they need a heart doctor to go in and help clear the blockage. Some people just need some medication, and they don't need that full intervention, and they will get better with just a little bit of medication and some monitoring. So in the acute setting, right, when it's happening, the treatment can be different based off of where it is and how much blockage there is. So heart attacks can look very different and very varied. And so some people might even need like a surgery to help go around the blockage. So those that will have the surgery, that's going to be a longer recovery time. There's some cardiac rehab where you can work with specialists that help guide you through a program to help your heart get stronger and better, and so back to the place where it at least was before. And then once you're at that place, then you can work on getting it even better, but getting you back to at least where you were before. Those that even have like I don't even want to say like a less of a heart attack, because any heart attack is a heart attack in of itself, but those that can be managed less invasively, so less with medication, or they don't have to get any like inside cuts or interventions. Those would be close follow-up with your primary care doctor to try and address those risk factors, and then they'll help guide you in like a slow return to exercise program. But you might not have as much huge effects on your day-to-day.
Excellent. I think that is all of the questions we've gotten. You were saying, Dr. Byers, you felt like you kept repeating diet and exercise, diet and exercise. Yeah. Comes up in almost every Doctor Is In any topic we do. Obviously, it's so yes, folks here have definitely gotten that message before, but always great to reinforce.
It's an easy thing to say, harder thing to actually put into action. So
of course,
that's always the hardest thing to do. So it's easy for us to say it, but we will happily partner with you on trying to implement it, even though we understand that it's a very hard thing to do.
Yeah. And I'll let folks know one of Dr. Byers' colleagues in the sports medicine department is going to be doing a Doctor Is In with us later this spring, specifically on exercise. So we'll have some opportunity to look more at how to actually put those words into action. Dr. Byers, I want to thank you for spending the past hour with us. and for sharing all this great information, taking all of these questions. We always appreciate our Jefferson docs who come in and do these presentations with us. So thank you very much. I didn't mention this at the outset, but this was Dr. Byers' first doctors in with us. So very happy to have you. And then want to thank everyone for participating, whether you are here with us on Zoom or watching this recording later or checking it out on Facebook. Thank you for being part of the Doctors In, and thanks everyone who was here live for the great questions. And I think that we can leave it there. Dr. Byers, I'll leave you with the final word, though.
No, just thank you everyone for coming. Please, if you have any questions or anything, you can always send them over my way, and I'm happy to reach out with any questions that come up in recordings or whatnot as well.